So, one of the questions Nishan, talked about, what are we doing to support our patients, given these changes and this data. So we've been working towards getting our PRP services, having the capacity to deliver those over Televideo. We've moved our IOP program to Televideo. Our psychiatric nurse practitioner is doing all of her services via Televideo. And then we've actually, we've been talking a lot, and we've been in some meetings talking about Smartboxes and remote patient monitoring, and really kind of investigating some of these tools that we might be able to utilize. For our Medicare patients, Medicare already allows for reimbursement for remote patient monitoring products such as e-Mocha, just to name one. There's others, but we've really been exploring what technologies and services are out there that we can add on to decrease diversion, increase adherence. So I'm sure we'll talk about more of those things in the Q&A segment.
Great, thank you very much, Enrique. I did want to just see if you could give us a little bit of detail on kind of your urine collection process. And so it sounds like you're limiting the number of patients who are submitting urines at a time. Is there any PPE you're recommending? Is there staffing that you have for the patients that you could just give us a little bit of detail about that? I think that would be helpful for some of the folks.
So pre-COVID, our urine collection bathrooms were on the same floor as our offices and where our admin staff worked. And we realized that we couldn't continue that. It would be too many people and too small of a space. So all of our clinical work happens on our 4th floor, and we now use our 5th floor for urine collection only. We only have one staff member running it, and that person wears they wear a mask, they wear gloves, and we are able to stagger our urine collections. So the majority of the time, there's only one person giving their urine, one person checking in. At most maybe we have one other person waiting in the waiting area, but kind of amazingly, we've been able to stagger our urine collections, throughout the day to minimize, person-to-person exposure.
Great, thank you very much for that extra detail. I think that's just helpful to kind of visualize what's going on in your clinic, and it's great that you have that extra space to utilize. I think that's kind of the commodity that's very helpful there.